if you were a healthcare provider, you're a doctor, you're a children's doctor, you're not sitting around worrying about data security. I mean, this must seem to so many healthcare providers and clinicians, and even at a hospital level, like somebody else's problem, right? Or how do we because I've been writing about cybersecurity for 20 years now, and there's always that question of how do you get the people in charge to realize, no, security is something that you have to invest in. I mean, what are your thoughts on that and how that's playing out in healthcare? And I would imagine events like this are bringing it home for people.
Making it acute.
Yeah.
Providers, like you said, they are brilliant, they care, they're there to do one thing, and that is to save and improve human life, human well-being. Managed healthcare has become an industry now over the last few decades, and that's a whole different policy conversation. Mm-hmm. But managed healthcare, they're providing digital services too. They are tech companies. United Healthcare is a tech company. And so as a tech company, they have to think of themselves as the responsible party for protecting patient data and services to enable access to healthcare. These are tech companies now, and we need to treat them that way. Change Healthcare is a payment system, right? We need to treat them that way. We need to start helping hospitals, helping providers, but the tech companies that manage the services, that manage the healthcare in between, to become cybersecurity professionals, full stop. We need to be able to give rural hospitals the resources that they need in order to be able to employ managed service providers or cybersecurity or cloud service providers, giving them the training that they need in order to be able to look at vendor contracts in a particular way, in a way that they're not used to looking at, giving them the resources that they need to be able to deploy endpoint detection and explaining what that is and why it's important. We need to be able to fan out into those rural areas, into those areas that provide healthcare services to the most needy, the under-invested communities possible, and help them to become cybersecurity professionals, because it's sort of one and the same. It's another tool to enable the delivery of healthcare service.
Is it ultimately a matter of educating people there or getting more people with those skills to take those jobs in those rural facilities?
It's a matter of training and resources, right? You can have a plan, you need a plan, but without resources, without adequate training, you don't have much more, right? So we need to incentivize people to get out there and become cybersecurity professionals for healthcare systems and to retain those trained professionals. We know in the cybersecurity space, we tend to move in and out, private sector, public sector, large companies, small companies. I'm a good example of that. Yeah. But the more people we can have out there that understand the intricacies of the healthcare system and understand how to secure data and the information networks that the data flows on, the better off we are system-wide.